Hi, my name is Brian Wormers, and I'm going to be the professor for this course for Pediatric Nursing, NUR 447. And this is going to be just an overview of the course and a review of the syllabus. In a later document, I'm going to record discussing the clinicals, and in some further ones, we'll talk about some of the soft shock modules. So to start off with, my name is Brian Wormers. I've been a nurse for over 2 decades now. I graduated from SDSU with a BSN in nursing. Worked in general peds for 1 year, peds ICU for another year, did travel nursing in peds ICU, so the University of Minnesota and University of New Mexico, and then came back home, did some flight nursing, did that for about 5 years, and then went back and became a nurse practitioner. Got that from Seton Hall University out in New Jersey. Worked as a pediatric nurse practitioner for a couple of years, and then got a job at USF. So that was over a decade ago. So my qualifications for teaching this course, I suppose, are, I was a pediatric nurse practitioner. I have some kids. I was a kid. A whole host of things. But hopefully you can glean some insight from me. By no means am I the end-all be-all, but I do have some insight. I'll share some stories, and hopefully you can learn. So that's a little bit about me, and I'll tell you more as we meet in person and those kind of things. But as a review of the course, so this is your basic course information page. Going down here into syllabus, orientation, and course roadmap, you've probably found this already, so here's your welcome to PEDS, and this is what we'll talk about. Here's our syllabus, so you can see exactly what we're talking about. We're going to click on that in just a second and get through. And then orientation of the course, this is where you've hopefully found your clinical, the syllabus review and the clinical review. So, as well as in the future here, we're going to have some more recordings underneath resources. So, as we click on the syllabus, we'll just kind of do a walkthrough here. Being picky. So, this is University of Sioux Falls School of Nursing. This is Pediatric Nursing. We are going to meet on Mondays in the Fine Arts Center. Just not for the first 2 because we didn't have class this week, and next week we've got a holiday. So this is going to be online content that I want you to review, and then before the exam we will meet, talk about a lot of things, and go over a lot of things. But I do want you to be pretty independent here for the first little bit. Course description, so we're going to be talking about, we're going to introduce you to the pediatric population. And so this is going to deal with children and their families, and we're going to kind of build on those previous skills and knowledges that you've already obtained and grow from there. And so we will learn, some of the common problems of children and what they face and how we as nurses can help them and their families. Credit hour policy, this is going to be a lot of lecture. It's also going to have some sim, it's going to have some clinicals, it's going to have a lot of different things. So, on ground participation, I expect you to be in classes when we have them. That will help you understand the content. It'll help you be a part of the group, and you'll learn more. These are our learning objectives. So, by the end of this course, I hope that you can demonstrate person-centered care that recognizes the child as a client with some unique developmental attributes, that you could describe the health needs of children and their family utilizing a theoretical framework, that you can discuss some of the characteristics that place a child at risk for illness and injury related to the developmental stages of being an infant, toddler, preschooler, school age, and adolescent, and talk about some of the common problems associated with each stage. I want you to be able to communicate in a professional manner with children, family members, and members of the healthcare team. I want you to be able to demonstrate competence in completing a physical and developing assessment of a child. I want you to be able to use anticipatory guidance for health and well-being. I want you to be able to have clinical judgment by recognizing cues, analyzing cues, prioritizing hypothesis, generating solutions, taking action, and evaluating outcomes for pediatric patients and the family. And I want you to be able to integrate principles of quality and safety into the care of children and their families. So related to the School of Nursing mission, goal, and expected outcomes, everything we do have been mapped out. We've got a reason for why we do what we do, and so you can see that here, as well as our theoretical basis right here. Required resources, so I expect you to have an APA book. You should probably already have that. We will give you the ATI book. You should all have this one. And then the textbook is split with maternal nursing, maternal newborn nursing. And this is by Perry, Hockenberry, Cason, Eldon, Olshanke, and Loudermilk. Evaluation, most of this is going to come from exams, but there are going to be 4 exams. I'm adding a new one this year. It used to be 3, but we're going to try with 4 just to make it a little bit more even and make it so that not every exam is worth as much points. You will do a physical development assessment on 2 different children of 2 different ages and stages. You'll do a teaching plan during clinicals. You'll have 2 concept maps to do. You'll have 4 quizzes. You'll have online discussions throughout. You're going to have class participation, of course, and simulation. Soft talk modules throughout, and then we'll do some ATIs, so practice, proctored, with remediation. There is going to be an AVA PIV course, so we're going to talk about IVs. This is an outside course from the American Vascular Association. I am working out the details as that just got through our legal department, and so I'll let you know more about that one. But that's going to be a series of 4 different mini courses that you'll take and learn way more about IVs than what you have already. And then culture for service learning, so you'll have to do an aspect of care for that. And finally, you're going to have a clinical component where you're going to have 4 shifts on the pediatric floor. You'll have some simulation, and then you're going to do a Health Connect fair. So during clinicals, we're going to use the Create and Competency Evaluation tool for clinicals and for simulation. So within this, you can look at the different reasons why we're doing it. Please realize what we're looking at is your competency. As you build up in your strengths of being a nurse, your competency level will increase. In this course, we expect you to have a competency level of 0.7 by the end of this. So by the end of clinicals. So I don't expect you to be able to hit the ground running, work all the pumps, know all the meds, know all everything. But you should be fairly competent by the end of 4 different clinicals and have an understanding of this level of 0.7. Clinical makeup policy, so you can see that it's listed underneath the references. If you miss clinical, then there will be a clinical presentation that you need to make up, and all the guidelines are there. Professionalism points, you start off with 2.5%, but with this, you need to show up on time, be in class, be participating, be professional, treat others with respect, and then you get your points. If not, then you'll lose some points. Late assignments, we will have comfort passes, and you'll have 2 of those, but otherwise I don't like late assignments. I want you to be on time. For me, this stems from you have to give your meds on time, you have to do your procedures on time. You have to give your antibiotics within so much time of a patient arriving. So time is very important to me. And yes, I know things happen and life happens, but I really want you to do your best to be on time with this. There will be extenuating circumstances that are sometimes beyond your control, and with that, you're going to have to talk to me about this. But generally speaking, I'm kind of firm on my due dates. Grading for the class, typical nursing, so 90, 80, 70, 60. You need a B- to advance within the program and pass this course. Policy and procedures, so service learning. We do a service learning for this course. Within this, I will let you pick what you want to do. I really would prefer if you do something related to nursing. If you want, you can help out extra at the Health Connect Fair or something along those lines. If you need help finding something to do and a place to volunteer, let me know. I've got a couple of ideas and I can help you out with that. Academic honesty, don't cheat. Don't cheat using ChatGPT or any of the other AI. Make sure that this is your thoughts, and that way I can help you grow and develop as a person. If you do not and you cheat, then there could be consequences with this, including, failure of the assignment or possibly even getting kicked out of school. Compliance with the ADA, if this impacts you, please talk to the ASC for accommodations. Program assessment, at the end of this, I want your feedback and your evaluation of the course, so we will do IDEAs. However, throughout the course, if you've got great ideas for me to improve this, let me know. I'm all about that. I want to make this as good as possible, realizing that every group of students is different and your needs are different, so I can adjust on the fly, so you just got to let me know sometimes. Copyright, make sure that you are citing and referencing your materials and giving credit to those people that came up with it. Status of the syllabus, so I am trying to be fair with this one. I know that this is different than the one I sent you out in email, so I do want to go through this carefully with you. But if there are major changes, I will contact you and let you know. Probably via email and in class. So now looking kind of on a week-by-week basis, I'm going to record lectures for the 21st Century Pediatric Nursing, Family-Centered Care of the Child, and Pediatric Nursing Interventions. You're already listening to the intro of the course currently, and I will do a review of the syllabus. So, reading this week. So, to be successful in this class, really focus in on my soft chalk modules. That would be the first thing to study. ATI is probably the second thing I would study, and then if you need to, then I'd study the book. Everybody does it a little differently, but the main content will be off the soft chalk module. So I use the ATI book and the textbook as supplemental materials. So if you are not understanding a concept, then go to those and look that material up. But testing wise, a lot of it will come off the soft chalk module. So that being said, your assignments are those soft chalk modules. Also, just starting off the semester, you're going to have clinical orientation soft chalk modules due. And so you got to have this one, talking about your competency at Vera and Stanford. Vera rolled out some new charting on their Meditech system, and they want you to do an update. So you'll have to do that by the end of this week. And the links are in the LMS. And then you'll have an OSCE with formal evaluations and peer-to-peer evaluations with that. And then there's a soft chalk module based on preclinical OSCEs. So on 9/2 is Labor Day, so I regret that we don't have class, but I will record lectures for child development, an introduction to family theory, and talk about social, cultural, and religious and family influences on child health. And so I want you to do those soft chalk modules related to those. And then there's going to be a forum posting. So you are a little busy for this first week. Second week, I'm trying to get you caught up and have a little bit of a reprieve. So week 3, talking about communication and physical assessment. And then we're going to prep and plan for the Health Connect Festival. With this, I want you to go into the LMS. There is a site for you to sign up. Under resources, it'll talk about the Health Connect Fair. It'll give you some background on it. It'll give you a link for a volunteer, and it'll give you a link for to sign up for what you want to talk about. And I'll show you that just here in a little bit. If you wanted to, in addition, you can sign up for additional hours, either before or after, like maybe the day before, helping set up or do something like that, and that can count for your service learning. We'll have a quiz. I'm going to have 4 quizzes in this course. It's going to cover content right before your exams, and so you'll get to do that. You will have concept maps, and I believe that you've done concept maps before, but we'll kind of go through, and I'll give you some when we meet in class this day, I'm going to go through, we'll walk through a concept map, and then before you turn it in, you can kind of see what I'm expecting out of this one. If you type A personalities, I'm sorry, you might not like this one, but this is a really good learning thing. And this should be everything that you need to know about your patient. And I've actually even known some nurses that have a concept map for their, their brains, but it's all the material you should know about your patient that you're caring for. Week 4 is the first exam. We'll be over contents weeks 1 through 3. And then you're going to notice that we're switching into more of a systems-based. So up here is a lot of theory and talking about the background for kids. So that's the first third of the course. The next 2/3 of the course is going to be more like med-surg, and you're going to talk about respiratory, and you're going to talk about heme, and you're going to talk about cardiovascular, and we're going to go more systems-based that way. So just so you have an understanding of the structure of the course. So moving on here, soft talk module before class is due, and then we're going to have a Health Connect fair discussion. I want to hear your experiences during that fair. We'll talk about respiratory some more because this is a big topic, and so we can use these extra hours. There is a child abuse conference that I want you to attend, and that is on October 3rd. So I want you to do some reading before that and just have an understanding of what some of these kids can undergo, unfortunately. And so then there'll be a Child's Voice conference. There is a link that I need you to sign up for, so you need to sign up for this. This is provided by the University of Sioux Falls. We will buy your ticket. This is an all-day activity. They will feed you, generally speaking, fairly well. This can be a very hard day for some people, though. This is usually not the feel-good event of the semester. But it's very important that you have some exposure to child abuse and to be looking for it, to know how to handle you, handle yourself, as well as, what to do in these situations. So, and we can talk about that more in class. So we'll also talk about hematologic and immunologic dysfunction. So you'll have a soft talk module with that. With this, you'll have an H&P, so a physical and developmental assessment of 2 different kids at different developmental stages. What I want you to do is do a write-up. This is going to be medical shorthand telling me everything about this child. And then you're going to do a developmental assessment of that child. On the units, there are going to be some books that you can utilize. It's got, what should a 2-month-old be doing, what should a 4-month-old be doing, what should a 6-month-old be doing, etc., etc., etc. And then you have to kind of look and see at your patient and where is your patient at. They might be ahead of the curve and they might be doing things that they shouldn't be doing, or they might be a little behind the curve, especially if they've been in the hospital for a while. So, and then you get your physical assessment and developmental assessment, and then with this I expect you to be able to do some anticipatory guidance. So be able to teach the caregivers what are the next stages for this child and what should they be doing in preparation for that. Concept map 2 is due here. Cardiovascular dysfunction is this week on week 7, so we'll have a soft talk module related to that. And then there's going to be a posting about the Child Abuse Conference and your thoughts and just some reflection from you. We will have simulation journal due on 10/13. So all of you will get 4 hours in the sim lab. At the beginning of it, I'll kind of run through what you need to do and what's going on. There is prep work for this, so make sure that you do that prep work prior to coming into the sim lab. Then we have fall break. So I didn't do much for this one, except for there is a quiz due at the end of this. So this is a week to get caught up, work ahead, get whatever done that you need to do. And then there's exam 2 over weeks, 4 through 7. Then we're going to move into cerebral dysfunction, endocrine, pain. And so you're kind of seeing that you've moved out of some of the clinical stuff because you are going to be done prior to fall break. And so you're kind of front-loaded with a lot of your clinical assignments, so you won't have as much later on. But then GI, GU, we'll talk about PEDS Med Calc, so you do need to be able to do med calculations. You do need to know what things are, like, what's a troche? How do you convert from pounds to kilograms? How many mils in a teaspoon? all those type of things, and weight-based calculation, converting from pounds to kilograms, and how many milligrams per kilogram, how many mils per kilogram, etc., etc. Then we'll have a week 3 exam over content from weeks 9 to 12. Then we'll talk about musculoskeletal, neuromuscular with soft chalks and class activities, and chronic illness, disability, and end-of-life care and pediatric emergencies. And then we'll come back and talk about cognitive or sensory. We'll have a proctored ATI exam. You should have your practice ATI exams done here. And then your final exam, which is going to be on 12/13 at 10:30, and that's going to cover the last quarter of this course, as well as have some comprehensive content on it. I am revamping all the exams currently, but I will give you a study guide that should help you and guide you and give you some direction as to what to study for. I just want to make sure that all the content lines up with what you're learning, and so let me revamp it, let me tweak it and improve it for you, and then I'll get it out to you. So this covers the syllabus. If you have any questions on this, let me know. I think it's straightforward, but I know not, if you disagree with that, please contact me. For contacting me, you can see me in my office, which is 220B. I've got office hours on Mondays from 11 to 1, or Fridays from 9:30 to 10:30, or make an appointment with me. I'm happy to come in, meet you at USF, at my office, or Starbucks, or wherever. Let's talk about this, and I want you to know the content. So that is that. Going back into the LMS, I think that you have a good understanding of this, but if you have any questions, let me know. So on this one is your welcome and your syllabus, and I'm guessing that you found that since you're watching the video. Clinical schedule, I'll make a different video talking just about your clinical schedule, but you can see that and access that here. Attendance, you don't need to worry about. Course organizer, some people like this to see what's coming up next as far as coursework. Resources, you're going to have lots of different tabs. This is where you're going to have soft chalks that are not graded, so you can go back through and look at any of the clinical things. You can look at any of the content things. This is also where you're going to find where to sign up for the Child Abuse Conference, which you need to do early in the semester. At the end of it, I'll do a clinical evaluation using Alchemer. You will have some resources such as a hormone chart, and we'll talk about service learning forms. Health Connect Festival, this is a link to a document that tells you about it, tells you how to sign up for an area that you are going to work, because you're going to do a booth with this healthcare festival. And I want you to talk to Fran Rice and get some equipment for your booth. You will sign up for the specific topic, but you and your classmates or your partners, whoever sign up with that, will develop the content for what you're going to teach. Make sure that this is relevant for the population, and really focus in on kids and what they're going to do. But this is you taking that information, sharing it with others, and it's an important aspect of nursing. So it's going to run from 11 to 3. I want you there from 10 to 4, so it's going to give you some time for prep, setup, tear down, those kind of things. You can run this however you want. Generally speaking, you've got to have something at your booth to draw people in. Be aware that you might send mixed messages if you are giving out candy and you're talking about nutrition at your booth or something along those lines. You will wear your scrubs for this event. You will volunteer for half your shift, so your booth will have about 4 people in it, and 2 people at a time I expect to be at the booth, and the other 2 people will be running and volunteering at the event. I also want you to be walking through and seeing this event and seeing what resources are available in your community, and that's an aspect of this as well. So for working at this, you will get a free t-shirt, you will get a free meal. The meal, I think, is going to be some pulled barbecue, like a barbecue sandwich, a little Baby Bell cheese with some milk or water. So it's probably not fine dining, but it is a meal. And so this is what I want you to read through and have an understanding before you sign up. So, but please choose your area and then choose half of your time that you're going to volunteer doing other things. Sanford roles, this talks about the different roles if you get clinicals at Sanford. Clinical absence algorithm, so if you missing, this is what we'll use. This will be your makeup clinical assignment and the rubric that we'll use to grade that. These are all your soft chalk modules that are not scored, like I mentioned before. So it's the same as the other ones, it's just you don't have a score associated with it. For simulation, there is a prep guide here. I want you to have this complete prior to simulation. I know for some of you, you start simulation really early. This will take you a couple hours to do, but it is a great prep for simulation and what you're going to encounter. Development, I made some templates for you to kind of understand what's going on with these different ages and stages, and that should help you when we test about these kind of things. There is a blank one here, which I think is great, so if you want to study, take a blank one, pick your ages and stages, and then write down what you think it belongs to that. Study guides, I'm going to revamp these and I'll get these out to you. And that's kind of the resources tab. Coursework is next. You'll see this listed as in chronological order. So you've got your soft chalks here and the ones that you need to do. Some of it is related to the OSCEs that you'll have on Wednesday. So, and then you've got OSCEs here for your general assignments, and this is where you're going to have your Vera charting. This is where you're going to have quizzes, exams, discussions, concept maps, head-to-toe write-ups, etc., etc. All right, grades, you can find your grades here. Forum posts are here, and roster. I don't know if you've got that tab, but that's kind of an overview of the LMS and the class. If you have questions on this, please let me know. I know that we're starting off in an online format initially, but I want to know if you have any questions. I want to help you out with this course. Within this course, some people don't understand why of pediatrics. I will challenge that in the fact that you're going to use some of these skills in a variety of different settings. If you are an emergency room nurse, guess what? You're going to see kids. If you're a family practice, you're going to see kids. Even if you're in the adult ICU, they will take teenagers into that adult ICU depending on the mode of trauma. So if there's a bad MVA or something like that, you might see kids as young as, I've seen 13-year-olds or younger in some of the ICUs. That's an important consideration for what you do. This can also be a great thing for if you ever have kids. And with this, learning the ages and stages and what you're going to be going through can really help you out. So PEDS is great. I really do expect your full attention, and I think you're going to have fun. PEDS surprises a lot of people. I've done some great things on PEDS. It's wonderful. I've loved my career. You get to do lots of fun things in pediatric that you don't get to do in the adult world, such as make paper airplanes, play video games, light off rockets, pull kids around in a wagon ride, and that's all called work. So it can be so much fun and so rewarding. So give it a chance, have an open heart with this, and realize that you will probably see in pediatric situations throughout your career, and this class can be a great fundamental start for it. So, all right, can't wait to see you in person, and I hope you really enjoy this class.